Your back or your neck hurts. Shooting pains down your legs or your arms. You've been going to the chiropractor. You've been taking pain medication, having injections. It's been going on for months, maybe years. Does any of this sound familiar? As time passes and the condition worsens, the complexity of a surgical intervention may increase. And at some point, you will likely need to ask, when should I see a spine surgeon? Though spine surgery can often be the key to relief for back or neck pain sufferers, the process between seeking treatment and the day of the operation can take quite a bit of time. Finding the right surgeon, attending multiple appointments, and getting your surgery on the doctor's schedule may take months. And as conservative treatments lose their effectiveness, it may be helpful to begin investigating your surgical options early to prevent extended and unnecessary suffering should you decide to take this route.
We always try to counsel our patients to go with conservative treatment, therapy modalities, maybe some activity modification, medications, and try the tincture of time to see if they can get better. And for most people they will, and they won't need surgery. But for those where they've gone through that conservative pathway and they're still very limited and the quality of their life has become minimized because of pain, those are the people that may be candidates for something surgical to try to get them back that quality of life.
Well, I think all of us in spine surgery, we counsel our patients about the quality of life. It just does not make sense to have some type of intervention until you're really at that point where you say, all right, I've had it. I can't play with my kids. I can't do the things I like to do for pleasure. I need to do something. My work is being affected and my whole personality is being affected.
But quality of life isn't the only consideration. Unfortunately, many pain sufferers continue to put off surgery or even investigating their surgical options out of fear.
I think that unfortunately there's a lot of misperception of surgery and surgical outcomes out there in the public. And because of that, people are afraid to even come in for a consultation.
Because I think a lot of patients are unnecessarily afraid of surgery, I would suggest they come in, get evaluated by a reputable spine surgeon and have a frank discussion with them, make sure they've gone through all the diagnostics. And if they are a candidate for surgery, then they should ask all the questions.
The most important step is to make an appointment to have these discussions before pain begins to do harm to your life, your career, and your relationships.
Pain can really bring out the worst in you. It changes your personality, it changes your ability to interact with your family and do stuff with your children or your loved ones. And so I think that as a surgeon, to be able to see somebody that comes in that state, to be able to offer them a procedure and then see their life change for the best, I mean, that's what brings joy to what we do on a daily basis, and that's kind of what gives meaning to why I chose this career.
And patients can perform very, very well. Now, not everybody's going to go out and win the Masters, but nonetheless, you can get your life back.